Hey, I'm Cassian. Welcome to my channel, or welcome back to my channel. Today's video is called Fat, Anxious, and Eventually Diagnosed. Um, give the quick normal disclaimer. I'm sharing my experience with chronic illness, medical dismissal, and eventually diagnosis. This is not medical advice. I'm not telling anyone what diagnoses they have or what treatment they need. Just sharing my story. So I want to be clear, this isn't an anti-doctor video. There are good doctors. There are doctors who listen, care, and actually want to help. But this video focuses on what happens when you see doctors that aren't like that. Especially as a person who's overweight and has mental health diagnoses, especially because the easiest explanation became priority over real answers in my case. For me, these things have led to years of missed answers, years of doubting myself, and a lot of medical trauma. I want to talk about my physical health diagnosis, but more than that, I want to talk about the years before the diagnosis. The years where I knew something was wrong, but I couldn't get people to take me seriously. I could tell pretty young that something was different about my body. About 8 years old, shortly after I got my first menstrual cycle, I remember something felt off. One of the first times I remember clearly knowing something was wrong was very soon after that. For the first time ever, I had asked to miss school and go to the doctor. And that was a big deal for two reasons. One, I loved school, huge teacher's pet. Two, I hated going to the doctor. I was absolutely terrified of the doctor. I remember my mom was so shocked that she actually took me straight to the ER instead of making an appointment with my pediatrician. I don't remember every detail after that, but I know I ended up needing 2 bags of IV fluids and was sent home with my first UTI diagnosis, the first of many. By around 10, it became more obvious that something was wrong. At that point, pattern was usually the same. I'd fill off, go to the doctor, be told that nothing was wrong after blood work, throat swabs, flu tests, or whatever else they checked. Then, a week later, I would end up back at the doctor and be diagnosed with strep. That happened more times than I can count through my childhood. Other times, I would end up in the ER for things like headaches, chest pains, stomach issues, and most of those visits ended with the same kind of explanation: UTI, anxiety, or both. The confusing part was that I usually felt a lot better after the hospital visits. At that time, it made no sense to me. Looking back now, I realize it was probably the IV fluids. For those of you that don't know, with POTS, you have trouble retaining water and just like electrolytes, hydration overall, and you feel very sick from that often. You get headaches, you get body aches, your stomach can get upset, you can get really tired, you can pass out. So I think that's why the IV fluids made such a difference in my case. In the beginning, it was annoying and inconvenient. I loved school. I'd get upset when I had to stay home or when I got sent home from the nurse, but over time, it became more than inconvenient. I could not always do the things my friends could do. I couldn't be outside for long periods of time. I started missing school more often. Eventually, that turned into truancy threats and police officers knocking on my door. I was also having episodes of passing out and sleep attacks, but instead of people asking what might medically be wrong, I was accused of things like just trying to skip school or using drugs. Around 11, things got worse. It was the first time I remember fully refusing to go to school. The confusing part was that I still liked school. I would go to bed looking forward to going the next day, and then I would wake up panicked, angry, overwhelmed, and completely refusing to leave. That became my morning routine for about 3.5 years. At the time, my family and I assumed my mental health was just getting worse, and maybe mental health was part of it, but the part I could never make sense of was what happened afterwards. I would go back to sleep, wake up a few hours later, and suddenly want to go to school again. Sometimes I could make it in, other times I had missed too much of the day or I just couldn't get myself there. I understand now that those episodes were likely connected to my MCAS. With MCAS, you get something called histamine dumps, and they frequently affect what mornings look like and what waking up feels like. So I would wake up with intense sleep inertia, a very disconnected from reality feeling, and a wave of fear that I couldn't explain and didn't really make sense. Sometimes, instead of those episodes, I would experience sleep paralysis and not be able to communicate at all, just be freaking out and unable to move. At the time, no one knew that though, so from the outside it looked like I was refusing school, being dramatic, or having a mental health episode. This went on from around age 11 until I was 23 when I finally started treatment for MCAS. And I noted that this was my life for 3 years. The reason that I say only 3 years is because after that, we started implementing things to try to improve it. So at some point, I was homeschooled. At some point, I did hospital homebound. At 16, I completely dropped out of school and just got my GED. And then it was issues with jobs and losing jobs over and over again because of these episodes and episodes of passing out at work. Looking back now, it feels like my body was trying to tell me and everyone else something, but everyone was just reading it as behavior. When I would get my monthly cycle, I couldn't leave my bed. It wasn't just normal discomfort, it was completely debilitating. And instead of answers for that or any of the other things I had going on, I got explanations that really didn't explain anything. I was told it was anxiety, my weight, depression, being dramatic, normal. I was treated like I was skipping school, attention seeking, or imagining or just making up things. Sorry. Some of the things that doctors said stuck with me for years. Just lose some weight, you're imagining things, it's anxiety. That's not possible, you're just making it up. When you hear those things enough times, especially as a kid, it starts to become your inner voice. At first, being dismissed felt embarrassing, felt frustrating, it made me feel crazy, it was defeating, and it was scary. Over time, that fear and embarrassment changed into anger, changed into a fear that maybe I was losing connection to reality. It changed into avoiding doctors because I knew I wasn't going to be believed or listened to. And it changed into becoming hyper-aware and anxious anytime my body felt sick. At first, being dismissed just felt embarrassing, but as time went on, it felt so much worse. There's one appointment that I had that stands out as the moment that really shifted things for me. At the time, I had a pediatrician who was kind. She didn't ever have answers for what was going on with me, but she listened and she was nice. I had an appointment though one day, and I get there and was told I would be seeing a nurse instead. The appointment was terrible. I remember being accused of lying. I remember being told to stop skipping school. I remember comments made about me being transgender that had nothing to do with the problem at hand. And after all of that, I was told I couldn't even get a doctor's note for the appointment because she had told the front I wasn't allowed to have one. I remember the day like it was yesterday. That was one of the moments where going to the doctor stopped feeling like a place I went for help and started feeling like a place I had to survive. And even now when I think about it, there's still a sting to it. Not just anger, but grief. Because when I was a kid, I was sick. I needed help, and instead I was treated like a problem. Eventually, I started doubting myself. I wondered if I was making it up. Wondered if this was just what bodies felt like, and if I was just too weak to handle it. Before appointments, I would go through my head thinking, they're not going to listen. Maybe I should cancel. Should I make them believe me? Can I make them believe me? Should I just leave? What if I'm exaggerating? Why do I even keep trying? It's one of the hardest parts of medical dismissal. It doesn't just delay treatment. It changes your relationship with your own body. I was first diagnosed with POTS around 14, but I was not given much information. I was basically told drink a lot of Gatorade, drink a lot of water, eat a lot of salt, and it'll fix you. Meaningful answers didn't really start coming until I was around 22 years old. Eventually, I was diagnosed with POTS, postural orthostatic tachycardia syndrome, hypermobile Ehlers-Danlos syndrome, mast cell activation syndrome, and polycystic ovarian syndrome. These diagnoses explained so many of my symptoms that had been written off as anxiety, weight, or mental illness. Mental health symptoms don't cancel out physical symptoms. Being fat doesn't mean every health issue is caused by your weight, and being anxious doesn't mean every symptom is imagined. When I finally started getting answers, I felt a lot of things at once. I was shocked, relieved, angry. I cried. I researched obsessively. I told everyone I knew as many times as I could. I joined support groups and I deep dived into treatment options. Getting diagnosed was validating, but it was also painful because once I had answers, I had to grieve the years where I didn't have them. I had to grieve the middle school years, especially. I had to think about how much of my life could have been different if someone had just listened to me sooner. The turning point was not one single moment. It was a combination of self-advocacy, research, medical documentation, and eventually finding doctors who were willing to listen. When I was 21, I met someone with hypermobile Ehlers-Danlos syndrome for the first time. They explained what it was, how it affected them. They also talked about things that they thought that was completely normal, but it turned out to be symptoms, like being extra bendy or getting injured really easily. As I listened to them talk about their body, it felt like I was listening to someone describe my own. I started asking questions. They answered what they could, and they encouraged me to keep looking into it. They explained that they had gone years without a diagnosis because a lot of doctors were not familiar with hypermobile Ehlers-Danlos syndrome. So that's what I did. I started researching. I learned about HEDS, and then I came across information about POTS and how the two can overlap. From there, I started seeing other conditions mentioned alongside HEDS, like MCAS, gastroparesis, Chiari malformations, and others. I looked into each one to see what they did, what sounded familiar, what I resonated with, and what I didn't. Eventually, I ended up making a notebook where I wrote down every piece of medical history I could remember. My symptoms, when they started, things that helped them, things that made them worse, past diagnoses, past testing and results, current and past medications, reactions, anything that felt like it could even be somewhat relevant to what was going on with me. And then I set it aside for a few months. Because even though I'd gathered all this information, I had no idea what to do with it. I had connected so many dots that it almost felt fake. Things made too much sense, and somehow that made me doubt myself even more. Eventually, I decided I would start with neurology. I already had a POTS diagnosis, and I had learned that neurologists often treat it. My doctor gave me a referral with very few questions, and I went. The neurologist confirmed my POTS. He actually educated me on it and started me on medication for it. Medication I had previously been told did not exist. But it didn't stop there. Because he understood POTS, he also knew about some of the conditions that can show up with it. He asked follow-up questions. Those questions led to more testing and evaluations, and eventually I was told that I did in fact also have HEDS. That gave me enough confidence to talk to my primary doctor about my other concerns, especially the symptoms that I thought could be connected to MCAS. At my next appointment, I brought in my notebook and I explained what I had been noticing. She listened, then she decided to look back through my medical records to see what testing had already been done. What she found wasn't nothing. She found years of blood work showing elevated white blood cell counts and other markers that suggested something had been going on, so she referred me to a hematologist and an immunologist. Those appointments weren't easy. There was a lot of dismissal. There were a lot of rude comments. At one point, I was even referred to as a basket case by my own doctor. Not my primary, to clarify. But by then, I had learned to fight for myself. I pushed for testing. They were clear that they expected the results to come back normal, but they agreed to run them because the testing itself wouldn't harm me anyways. And then the test didn't come back normal. Eventually, that led to my MCAS diagnosis. That was one of the biggest shifts for me, not because everything was suddenly fixed, but because I finally had proof that my body had been trying to communicate something for years. I also had doctors who finally listened, a neurologist who helped with my understanding of POTS, a primary care provider who noticed patterns in my blood work, a diagnosis that confirmed something I should have known, something I had known my entire life. My body wasn't normal and I needed extra support. Looking back, I wish doctors had listened to the chronic pain complaints. I wish they had listened when I talked about mobility issues, getting injured in weird ways, strange allergies that didn't stay consistent, chronic exhaustion, trouble waking up, and food intolerances. I wish someone had told me that doctors don't know everything. I wish someone would have told me that doctors are often trained to look for the simplest explanation first, but that doesn't mean the simplest explanation is always correct. So for HEDS, the mascot, so to speak, is a zebra. And the reason for that is a common saying that doctors are taught in medical school. I'm probably going to mess it up a little, but it's something along the lines of when you hear hoof prints, think horse, not zebra. Essentially to say, like, the simple answer is what you need to assume is going on. You don't need to do excessive testing. You don't need to think about all these weird possibilities. It's probably just something normal. So that has done a lot of damage in my life and many others. But out of all of that, I wish someone would have told me that I knew my body best. One of the most painful parts of this experience was when my family started listening to the doctors too. When the professionals acted like I was lying, imagining things or being dramatic, some of the people around me started to believe it. That hurt, and I'm still healing from it. I still carry anger because it wasn't fair. I was treated poorly, accused of lying, and that did damage. I carry grief because there's so much in my life that might have been easier if I had treatment and answers earlier. I carry fear that something will be missed again, fear that I'll get sick before something important and miss out, fear that I'll lose another job, fear that a doctor will be mean to me. I carry distrust. I struggle to trust myself when something feels wrong. Sometimes I ignore symptoms because I don't want to deal with another appointment. I also struggle to trust doctors, even when they diagnose me, because part of me still questions whether I'm making it up. I carry shame. My body doesn't work like other people's bodies, and sometimes I feel guilty for that. I also think back on the years where I acted in ways people didn't understand, like rage, isolation, or avoidance. And I know now that my health was part of that, but there are people I'll never be able to explain that to. And I still deal with imposter syndrome. Even with tests, even with diagnoses, even with documentation and flat out proof, there's still a part of me that asks, what if I'm lying? What if I'm exaggerating? What if I'm crazy? What if this is just what a body feels like and I'm too weak to handle it? This is what years of not being believed can do to a person. This experience changed how I support other people as well, though. As a peer specialist, I try really hard to not assume that I know someone's story better than they do. I listen, I ask questions, I teach self-advocacy. I encourage people to keep records, ask questions, and trust that their inner experience matters. I've also learned that I'm not alone. A lot of people have stories like me. That doesn't make it okay, but it does remind me that it wasn't a personal failure or a personal attack. It is just part of a larger healthcare problem. If you're watching this and you feel dismissed by doctors, I want you to know this. Keep trying. There are doctors who listen and care, even if they're hard to find. Keep track of your symptoms if you can. Make a binder, a notebook, a note in your phone. Write down symptoms, dates, patterns, test results, medications, reactions, questions you want to ask. Bring documentation with you. Bring someone you trust if you can. Ask for referrals. Ask what else could explain your symptoms. Ask what the next step is if the current explanation doesn't fit. And most importantly, do not let being dismissed become your inner voice. That is one of the mistakes I made. I allowed medical gaslighting to become the way I talk to myself. I let anxiety prevent me from advocating. I stopped going to the doctor for a while because it felt easier than being dismissed again. But what I did right was that eventually I researched, I advocated, I found better doctors, and I started believing in myself again. The biggest lesson I learned is that your body speaks to you and you should listen. I'm still healing from years of mistreatment. I want people to remember that they're not alone, and this is a story many people live through every day. Just because someone calls it anxiety doesn't mean it's fake, imagined, or exaggerated. And if I could go back and tell my younger self anything, I would say ask the right questions, stand your ground, and you're not making this up. Thank you for being here and listening to my story. If you relate, you are welcome to share your experience in the comments if you feel comfortable. Not because we need to compare suffering, but because people deserve to know that they're not the only ones and that others are dealing with this too. If anyone would be interested in hearing more about my notebook I created, my journey of learning to self-advocate at the doctor, and just managing all of this chaos, let me know in the comments, and I'll happily make a video focusing on that. Take care of yourself, and I'll see you next time.